That first year as a learning process, not only for us, but I think also for the state. The MIDC was swinging at a lot of moving targets with 83 or so county plans that they had to review and approve, but things seem to be moving better. A big assist for us in that whole process was all the tremendous support that we received from the county departments, especially fiscal services, IT, and HR is just awesome. And we also want to mention facilities because they do a great job of meeting our needs as well. As we move into our next fiscal year, we have just recently hired a full-time investigator as part of our staff. This will help us to comply with one of the new standards, which is basically what the MIDC is all about, is implementing standards for the practice of criminal defense. There are 4 of them. The first one deals with training and education for the attorneys. Every attorney is required to have a minimum of 12 hours every year of continuing legal education. This applies not only to the staff attorneys in the office, but also to the roster of attorneys that we have on standby basis for handling what we call conflict cases, where we may have represented a person who is now listed as maybe representing a person who's now a witness in a new case. It would be appropriate for us to represent the same person in both situations. That's one example of a conflict. So maintaining our task, one of our tasks is to make sure not only that all of our attorneys complete their continuing legal education, but also that the conflict attorneys do. Second standard deals with experts and investigation. Prior to the implementation of the Ottawa County Public Defender Office, if an attorney needed to have an expert witness in a case, he had to seek the approval from the court. We now have a separate budget for this, and on our cases, we are the ones that decide when and if and at what expense an expert will be called to participate in the case. Additionally, as I mentioned, we have now our own full-time investigator. Previously, we had been using investigator services on a contractual basis. We are really looking forward. Our young person, Jordan Madden, has just started. He's really excited to be participating, and we really believe he's going to be a tremendous asset for our office. The third standard deals with counsel at first appearance. This was one of the biggest headaches for us because it was a totally new thing 2 years ago, but thankfully with the interaction and cooperation of the courts, the Sheriff's Department, and the Prosecutor's Office, we've been able to implement a process for this. It primarily happens at the district court level, where a person has the opportunity, if they so choose, to talk to an attorney before they see the judge for the first time. Another part of that is documenting that we are meeting that standard. So we've had to create sort of a system to monitor that and have paper records to show that we are meeting that standard so that the MIDC knows how at least some of their money is being spent. The fourth standard that we have to meet deals with the initial client interview. That's separate from counsel at first appearance. We monitor to make sure that the standard is that the attorney assigned to represent a person must meet with that person within 3 business days if the person's in custody, and within a reasonable time if the person's not in custody. Most recently, the 5th standard has just been approved through licensing and regulation, Department of State of Michigan, and that deals with independence from the judiciary. prior standard was that, the prior process was that the judges made the decisions on when a counsel was appointed for somebody. And in our county, the judges worked from a list that they established and maintained. We basically, with the implementation of the office, took a huge step in that direction already, and we will await further instructions from the MIDC as to any further things that we will need to be doing. Nicole?
Thank you. This may be our third fiscal year, but it is our first time addressing the board. So congratulations to those of you who are reelected to the board after the recent election. And we thought it would be helpful for us to give you just a little bit of an introduction to our department and what we're about. Our slide clicker is not working perfectly, so I apologize for that. It sounds like technical difficulties might be the theme of the day, but as Phil alluded to, we had a previous system where attorneys were appointed randomly from a list, but it was a known list of folks who would get these attorneys when they couldn't afford counsel. And the old system was really primarily criticized for being too involved with the judiciary. By establishing our office, we really have created a lot of independence. We work basically like a law firm. We have a group of 15 attorneys. We have 4 staff, our special agent Jordan, as well as an office coordinator. And we can assign an attorney, and that attorney will follow that client from beginning to end. And that's what we aspire to, is just to provide really great service to our clients. We have a bit more professional coordinated response through our office to adapt to changes in the legal system, rather than having several individuals who have their own offices, own law firms doing this work. Furthermore, just financially, it makes a lot of sense for the county to have implemented a public defender office, as a statute has locked in the county's share of what it contributes to our functioning. Phil talked a bit about the standards that are implemented by the Michigan Indigent Defense Commission. We really have done I think, a laudable job of examining these standards and implementing them. We've had great partnership from the courts and the sheriff's department as well in doing so. Our office meets a lot with our regional counterparts to talk about how we've implemented these standards. So we're really trying to be exceptional and be providing leadership to our colleagues who are all trying to implement these new ways of doing business. We really attempt to be client-centered, provide exceptional representation, and provide equal justice for our fellow citizens who appear in Ottawa County courts. It was my understanding that maybe diversity, equity, and inclusion would be making a presentation today as well. If so, we thought that based on their presentation at the recent diversity forum, kind of marries well with the sort of things that we work on. If we want Ottawa County to be a place where you belong, Ottawa County is really a great place when it's good for everyone. And we serve a really small portion of Ottawa County's citizens, and they're often overlooked. But we're really fortunate to be able to provide excellent service to them in a professional way. We are also very fortunate to be able to refer our clients to many benevolent organizations within our community. And we are trying to coordinate more with CMH, especially, and other county departments to serve our clients the best we possibly can in a more holistic way. Bob Hamilton is here as well. He is the public defender for our office. He helps a great deal with guiding our ship through these uncharted waters. 2020 has been a very interesting proving ground for a brand new department, but in many ways it's been great to be a new department because we're not too set in our ways. So we've been able to be pretty nimble. We've handled over 7,000 cases since we opened. We began taking 100% of indigent cases in Ottawa County in April of 2019. Do you have anything you'd like to add, Phil?
Many of you may know that Bob, well, you can see Bob's here, but he's unable to speak. He had hip replacement surgery recently.
I can speak
Saban, he just gets really great people around him, and then we run with the ball.
We do feel like we have assembled a tremendous group of people, and we enjoy working with each other, and we collaborate on almost every case, and even seemingly minor misdemeanor cases. We have a lot of interaction with each other and share ideas and share approaches. For the future, one of the things we're hoping to be able to move toward is something called holistic defense, which is sort of on the horizon of where criminal defense.
Speak over it.
It's on the horizon of where criminal defense is going. One step we may be able to take on that in about a year will be possibly having a social work intern with us. Many of the people that we are providing legal counsel to come to us dealing with issues of substance abuse or mental health problems, and to be able to have that kind of insight, at least to us, would be very helpful. So that's one of the things we're exploring for the future. And that seems to be the way the MIDC is also interested in going as well.
Mr. Filski.
Yes.
Mr. Selski, I really appreciated the report that you gave to us. It's very informative, and it sounds like you've done a lot of good work in this last year. So thank you. Commissioners, any comments, or Mr. Garcia?
You know, I wonder, of the 15 attorneys you have, how many of them are bilingual?
We have 2 Spanish-speaking staff members,
Okay.
and I can speak just enough Spanish to be helpful in a hallway. By the microphone here. So we have 2 very, very helpful staff folks who are completely bilingual. We have a budget for translation services,
Okay.
and that is with in-person folks, not just through a language line that can be pretty clunky and really sort of discouraging and not very personal. We have a great relationship with local folks who we use as interpreters who appear at the courts with us or go to the jail with us to conduct interviews or visits with our clients. That's typically Spanish speakers, but we have access to translation services for any language that we need.
Okay, gotcha. Thank you.
And I do think that one of our attorneys is bilingual as well.
Okay.
Mr. Dannenberg?
Yeah, great presentation, but my question is to Al. Again, how did this, again, they are being paid by the state through us, right? The money comes to us and then we
Right.
pay them, right?
Right, so we were paying about $970,000 a year for the adult indigent services through the circuit court, mostly circuit court. And basically, when this proposal was first rolled out, it would have had the county sending the state $1 million and then the state making the decisions on how attorneys were appointed in the county. So we kind of led the charge and we fought back, and we were able to get the legislature to agree to freeze our 970 and to pay any costs above that to implement their mandate to change how these services are provided. So what we did, and I think we've resolved the latest point, the 5th one, because we organized this office under the board, under the administrator, and not under the judicial branch of Ottawa County. So right from the beginning, that was one of our strategies, knowing that this was one of the 13 points on the list that we were going to have to adhere to at some point. And so the state picks up, well, I think the total cost is what, 2/3 of the total cost of this office now, and they've added positions since we started. And I have to say that Bob and the team, Phil, Nicole, and the rest of the team have really done phenomenal work. I mean, they get calls from all over the state, from other offices on how to do things. And I think they've done a really good job taking a brand new thing and implementing it. It hasn't been without its bumps. I mean, you're kind of taking a new function, attorneys and all that, and dropping it right in the middle of a justice system that's operated much differently for 180 years. So I think that overall, things have gone very well. There's always things we can improve on. But certainly so far the state has kept its end of the money bargain. The one thing they did amend, we do have to pay costs of living up to 4% on our original cost of the office. And, but other than that, the base amount is frozen in that legislation.
We, who covers their raises and their benefits?
We pay
How's
the,
that set?
right, I'm sorry, Al, we pay the costs and get reimbursed by the amount the state agrees to pay.
Okay,
Right, so it isn't like the judges where the state actually pays most of the judge's salary.
right.
Here, we pay all the costs, but they reimburse us anything above that line that was set as a 3-year rolling average
Okay,
of 2010, 11, and 12 costs for the function.
okay. And their salaries are set by the state or
You,
by
the Board of
us?
Commissioners,
Board of Commissioners.
yes.
So could every county be different?
Well, certainly, yes.
Okay,
Right, yeah, well, that's a good point, because judges are the same statewide, because
Right.
the state sets those. But yes, attorneys, public defender attorneys are paid different amounts by different counties, yes.
okay. Thank you.
Anyone else?
Yeah, Mr. Chair.
Yes.
Yeah, I was for Nicole or Phil, and maybe I didn't quite catch it with the microphone, but we're at 15 attorneys, you said? Okay, and that is our foreseen kind of upper bound, or are we thinking about, we still not at capacity?
I would say certainly for right now, it's worked well. That's actually less than what was originally approved. It was, the original proposal was for 15.7 attorneys.
Okay,
And we had a,
Person?
yeah, well, we
We
could have had another part-time attorney, but we looked at it and then through discussions with the county and with the MIDC, we requested that 3/4 of an attorney be shifted into administrative.
sure.
So originally, we would have had 4 administrative positions. Now we have 5 total. And I think the total cost for those 5 is less than it would have been for 4 plus 3/4 of an attorney.
And so that caseload of 7,000, that's divided equally over the 15 attorneys, or do some attorneys have a higher caseload than others, or not really?
It varies. I would say most of the casework is being done by 14 of the attorneys. And the caseload, for example, Nicole and myself have some administrative functions, so we don't have, say, a full caseload compared to the next highest level of attorneys. The attorneys that have the busiest caseload are the level 1 attorneys, and those are primarily misdemeanors. So we try to get those caseloads reasonably close to each other, but they're not identical, and it's a shifting thing. So, for example, I just finished a very serious homicide case that took about 19 months total. That was quite involved, which meant less time to put into other caseloads. So,
Thank you, Phil, appreciate that.
We use a weight report within our case management system that weights the cases as well. So if you have a few homicides and you're going to have a few less cases than someone who has more misdemeanors, but generally they're pretty equal.
Okay, great, thank you, Nicole.
Any other questions? If not, thank you very much.
thank you.
Thank you.
Okay, I think we're ready for Lisa. Are we ready for Lisa?
So there
Yes.
she is.
Okay, hi, everybody. I'm going to share my screen really quick. Can everybody hear me? First of all,
Full screen?
okay. I'm going to share my screen.
There we go.
There we go.
Okay. Hang on though. Host disabled participant screen sharing is what I got.
1 second, Lisa. Let me see.
Okay.
Fix it. Make you, there we go.
All right, let's try that one more time. All right, I am going to go here. Can you see it?
Yep.
Yeah.
Yep.
Okay. So hang on one more second. I want to get to the right slide here. Not as good as Durrell is with all this technology. All right. Okay, so what you can see in front of you is our case by day map. And now this is probably becoming very familiar to you. And I like to show this screen because it really shows the dramatic increase in cases that we're seeing. So far, as of this morning, we've had 7,939 COVID-19 cases in our county. We have, I'm going to go to another screen, which I just had up, which is key indicators. We've had 88 deaths, preliminary case fatality of about 1.1% in Ottawa. And if you compare this, that would be about 3.4% in Michigan and 2.4% in the United States. So we are looking a little bit better with our fatality rate related to COVID than we are state and nationally. We've had a total of 263 total hospitalizations. Our hospitalization rate is about 3.3%. Our case counts, and this is kind of going back to that really dramatic epidemiology curve that I just showed you. Our case counts went up 124%, 124% since October 1st to date. Our hospitalizations are up 61%, and our deaths are up 31% over the same period of time. A third of the hospitalization, or excuse me, a third of our hospitals right now in Ottawa County have reported to us, which we monitor on a daily basis actually, that they're providing contingency care, which basically means that you know, they're experiencing such a surge of COVID cases that they're having to repurpose things and shift things around in order to care for the ill people that are coming in with COVID. 2/3 of hospitals are anticipating that this level of care will continue over the next week. As of yesterday, 11/9, 67% of hospital inpatient beds were in use, and 33% of them were being used by COVID-19 patients. 58% of our ICU, or our intensive care beds, were in use, and 29% of the ICU beds were used by COVID-19 cases. These statistics reflect, these statistics that I just mentioned reflect the 3 hospitals in Ottawa County. I also want to mention that we're seeing really staggering increases in COVID inpatient treatment in Grand Rapids at Spectrum Health, and also at Mercy Health in Muskegon, to the point where in Mercy, they are considering opening up the former Hackley Hospital as an overflow facility for cases that are being hospitalized in that area. This is particularly important to us because we do have a pretty significant amount of our Ottawa County population that does seek care in both Muskegon and Grand Rapids. We're also hearing, and this is anecdotally, but the increase in hospitalizations actually provides some validation to this, but we're hearing that people are feeling much worse and are much more sick with COVID than we were seeing in the summer. Meaning we had cases, but they were typically milder cases with a little bit quicker recovery time than what we're seeing right now, which again is of concern. Our test positivity continues to be an important metric that we watch very closely. I know you've heard a lot about case positivity. With the recent surge in cases, our overall test positivity increased steadily from 3% in early October to about 12% over the last week. And that's a 4-fold increase from early October to early November. Our daily test counts now stand at about 1,600 tests per day, and that's Ottawa County-wide over the last week, and that also is a sharp increase, that is a sharp increase, but the sharp increase in positivity is disproportionate to the increase in the number of tests that are being provided, which basically means that we are seeing a true increase in transmission. The current COVID wave is characterized by increases in cases in almost every demographic. When Jarrell spoke to you a couple weeks ago, he kind of went through the 3 curves. There were like little curve, big curve. We could attribute those early small curves to different demographics. And I think he mentioned we had long-term care facilities, we had cases associated with food processing, then we had cases in the summer that were attributed to gathering of kind of young people doing, typical summer stuff. Now we're just seeing community spread. We can't really attribute any of the growth in the number of cases to any one demographic, which is another point of concern. We are seeing cases in schools, but the numbers are increasing at approximately half the rate that they're increasing throughout the community. So about 10% of the total cases reported between October to date have been affiliated with schools across the county. And that doesn't include Grand Valley or Hope. And we think that the difference between the rate that we're seeing in schools and the rate that we're seeing in the community could be attributed, we're not sure, but could be attributed to the really fine job that they're doing with putting really strong environmental controls in place within the school, providing a lot of supervision. They're doing a great job to the best of their ability with social distancing and masking and hand washing. And we know that that's no small feat with young adults and small children. So I have to really commend our schools. We also believe in part that it could be due to lower numbers of testing among that age group. But again, that's speculation. Finally, the current surge in cases, we have about 220 cases per day on average. It has really, really, really significantly challenged our systems. We are backlogged right now. We have had to use this state system, which was put in place by NDHHS to actually help local public health during significant surges, which we are indeed seeing. The challenge, though, is that all of our surrounding counties in West Michigan and then lower Western Michigan are also seeing surges. And so very quickly, the state became overwhelmed. And so I just want to put it out there and let people know, not only on the board, but in our community, that if you're waiting for a call, hang in there with us. We are, as well as the state, is really working hard to get to people as quickly as possible. But we're really urging people that have symptoms or that are a close contact to somebody who has COVID to begin that self-isolation and quarantine process until public health can reach out to them and instruct them on further what they should be doing. But, I want to also remind people that isolation and quarantine means staying home, not going to work, not going out shopping, not going to parties, not going to school. It really just means staying away from all people for your period of isolation or your period of quarantine, which could be either 10 days or 14 days, respectively. We do hear anecdotally from our case investigators that some people get mild symptoms and they think it's maybe not COVID or not that big of a deal. And then they go to a meeting or a gathering and then find out later that it was COVID. And then, we've got a whole bunch of additional people that are exposed. So right now, while the case counts are really, really increasing dramatically, we are really pleading with our community to take those symptoms seriously, get a test, and isolate. It's always good to remind people of the layered approach, which when I say layered approach, I mean you have to do all these things together. One thing isn't really going to help, but using all these together really does help to mitigate the spread of COVID. Avoid gatherings, stay away from others when you're sick. Always maintain 6 foot distance from others and mask. at all times when in public or when around others that are not from your household. And always remember to wash your hands frequently. That is one of the best defenses against COVID-19, as well as any other communicable disease. I should also mention that kind of getting back to the schools, you may start seeing announcements in the news that schools are starting to go to virtual learning. We are hearing from a number of our districts that are making some of those decisions based on their case counts, and in some cases based on staffing shortages. We are seeing a number of school staff members who are testing positive for COVID, which puts a huge strain on the school's ability to continue in school learning. In every case, these schools are working very closely with us. We have great relationships with every one of our districts. They consult with us. We provide them with support and guidance, but in most cases, the districts themselves are the ones that are making the decisions to make changes to accommodate the real significant need for health and safety for their students at this time. So on that note, I want to just talk a little bit about some good news. I always give you a big downer, but there are some good things that are happening. You probably heard in the news that there's some real promising vaccine news that's coming out of Pfizer. There's also another company that their data is looking really good, that there's going to be another option for a very effective vaccine. We have been working closely with the state health department. We are also working closely with our health partners, our hospital partners, and our regional public health partners to come up with a really coordinated and effective plan for vaccine dissemination. So we'll have more to come on that, but we think probably at the very earliest late this year, but very early in 2021, we will be able to start doing vaccination for our population. I don't know if I mentioned this before, but if I didn't, I should have. We have a brand new mobile dental unit, and it is absolutely fabulous. I want you all to be able to have a chance to see it. So I'll work with Al, and we'll see how maybe we can provide a safe way for you to all get a peek at the new dental van. We already have had it on the road and have provided some services at one of our districts. Again, because of COVID, it's a little tricky providing dental care. It just requires a lot more personal protective equipment, but we are committed to serving our community in all the ways that we always have. And this new dental van is just one more really exceptional service that's provided by Ottawa County. And I want all of you on the board to know how much we've appreciated the support to purchase this new mobile dental unit. It's really, really fabulous. Also, I want you to know that, sometimes we understand that it's very difficult for our community right now. COVID has been a challenge on our schools, our businesses, our healthcare community, our residents, our families. It's been tough. And, sometimes people will call us and they'll tell us how they really feel. And sometimes that's not so good. But also I want you to know that we get a lot of really, really positive feedback. We have had just random thank you notes. We've had random drop-offs of bagels and coffee for our team. One day, a company sent over a bunch of pizzas for everybody with a big note of appreciation for everything that the local health department is doing for the community. And I also just yesterday received another card, and I won't read you the whole thing, but basically just to summarize it, they wanted to pass on their thanks to our team for the sacrifices of all of us on the public health team. And that those sacrifices and the long hours and the stress and the dedication to our community has not gone unnoticed. It says a quote, "I know it's not done yet, but the pride I have for this community has grown because of the tireless efforts I see from you and your team." And then big letters, "Thank you." And so I just wanted to end on that note. It is the work that we're doing here at the health department could not be done without the support of the board and the strong governance that you all have provided. I also just want to recognize administration, Al and Doug and Karen and Marcy, and just everybody has been so fabulous in helping us. So we are all a team. We are all getting through this together. And I appreciate all of you. And I really do appreciate the community. You know, even when we do get complaints, which, you know, we get complaints, everybody has a point of view, and we take those seriously, and we really try to hear those concerns and make alterations or adaptations to what we're doing to meet the needs of everybody that lives in our community. So on that note, I'll open it up to questions. And I can stop sharing my screen so that you can see us again. And Doc Heidel is here. He's real tiny, he's in the corner. But if you have any questions for him, he is here too.
Lisa, Mr. Dannenberg has a question.
Okay,
There she goes.
okay.
Mr. Dannenberg has a question?
I got about 3 of them. They're all tied together.
Oh, it's a limit of 1.
Yeah, I know.
Am I gonna have to write these down? Is this gonna be a try to stump Lisa question?
Okay, you said the number of tests are you doing? Okay.
Yep.
Are you stopping tests on a day because you run out of tests or because there's no more people to test?
We have in the past, Commissioner Danberg, we had to stop because we didn't have enough people. That was way back in the summer. Now what we're seeing is we've had a couple of cases where we've had to cut off the testing because we're completely out of tests. But I do want you to know that we make every effort to get as many people through as we can. We've even had our, we've used the National Guard. They've run all the way back to the state to get more tests to bring to Ottawa County so that we could continue to test as many people as we possibly can. So that is a last resort only when we just have no more options. So.
In the, somebody is close to someone and could be contacted and you need to get tested. If they call someplace, let's say Zeeland Hospital, what's the time frame before they could get tested in the time the test comes back?
That's a little bit of a moving target at this point. Generally, Spectrum just this week was saying that if you're a patient of Spectrum and you call and you use their portal to sign in, you should be able to get in the same day. But like I said, this is a moving target. It's changing every day. We planned, this wasn't at a Spectrum testing site. It was at one of our testing sites with the National Guard. And this was just a couple days ago. We had planned for 150. We had 300. And so you can imagine all of a sudden, we didn't necessarily plan on that. Things got a little backed up. People maybe didn't get in as quickly as they could. And we maybe had to divert some of those to 2 days from now when the next clinic comes up. But we're always also trying to link, if we can't provide it or if Spectrum doesn't provide it, we have other options, which there's Walgreens, there's CVS. Holland Hospital is using NextGen on their property to provide testing. North Ottawa is also partnering with NextGen, which is a lab to do testing. So there are other options available. And usually they can get in within a day or 2.
Okay, next one. What's the percentage of positive of the cases? We want to be under 3. What is Ottawa County right now?
We are at, oh gosh, I said that. I think we are at 12.5%.
12?
12.5%. Yep. And we've even had, we had one clinic that was one of the National Guard clinics that the health department did. And we had over 20% positivity at one clinic. We had one clinic that was over 30%. But if you take all the tests, all 1,600 tests that we did during the last week and combine them all together, we had a 12.5% positivity rate.
Oh, that's high. Okay, and you maybe can't tell me, but could you, where are most of the people getting positive or getting involved in it? What would you say?
I think And again, this is, oh, I'm sorry, go ahead.
My doctor told me, stay away from bars, restaurants, and church. That's now.
Al, I'm glad your doctor told you that. I'm not gonna say that.
I could go along with church, but I mean that bar business, I gotta draw the line. No, Lisa, do you see one higher than a different area?
Well, I think the common theme here is gathering in large numbers of people. And that's what we really want to emphasize with people. If you're in a big group of people, that's not a good situation. And if you are in a big group of people, you need to maintain more than 6 feet of distance and always, always, always have a mask on. And then as soon as you get out of there, you got to wash up, wash your hands, don't touch your eyes, don't touch your face. All of these together will really help to mitigate the spread. But, you know, overall, the gatherings is what we're seeing. I mentioned that in the school environment, we have really tight environmental controls, meaning that the teachers are monitoring the students, that they're making sure that they're masking, they're making sure that they're hand washing, they're making sure that they're to the best of their ability trying to maintain a distance from one another. They're cutting down on some of the activities that put kids together in groups. These are really helping to slow the spread. Once we leave those controlled environments, and even on a college campus, they're doing a fantastic job at Hope College and Grand Valley of ensuring safe practices. But once they leave, then, you know, people kind of let their guard down and you say, oh yeah, I want to get together with my kids and grandkids this weekend. But, you know, those are the kinds of situations where we're seeing community spread. So just be really, really careful. Practice the things that we all know we should do.
Thank you, Lisa.
Yes.
Greg.
Mr. Chair.
First of all, thank you and your team for what you're doing. I know you're under a lot of stress, okay? My question is this. A few months ago, the governor says, everybody mask up and social distance, and we'll get this under control. A few weeks later, Director Gordon, the same thing, says, you know, wear your mask, social distance, we'll get this under control. You know, our own department here says, wear your mask all the time, but yet we see this spike. Is this spike now something we're just gonna have to live with now until the vaccine gets out here? Because it seems like the folks of Ottawa County are doing a pretty good job of masking up and trying to follow the guidelines. I mean, is this something we have to live with for the time being, or is there some light here someplace?
Oh gosh, I wish I had the absolute answer to that. You know, again, you know, we're going back inside, which is a concern. Things are a little bit more precarious when we're inside. We are closer together. The air isn't circulating as well. That could be a factor, you know, as opposed to in the summer. When we started this whole thing, we didn't really see the amount of community spread that we're seeing right now, because remember, everybody was on lockdown. Now we are all open and free. We can go to the store, we can go to work, we can go to school, we can go out to eat. And we feel like it's safe to go visit friends and family and go to church and all those things that we love to do. I think we're gonna have to live with being constantly vigilant about it. It doesn't mean that we can't live our life. But if we are all consistently following those guidelines, even though they're inconvenient, I get it. I think we can really reduce the spread of this. And I'll give you a really good example. So when we had the outbreak at Grand Valley, their cases were really high, a lot of spread within the Grand Valley population. When we started our first lockdown, we had 70% of the cases in Ottawa County were attributable to Grand Valley. By the end of a 4-week period, and now remember, we put everybody in a stay-in-place order for 2 weeks, then we loosened it up a little bit and said, hey, look, you guys are really doing great. You're making some progress. You can now kind of gather in small groups, but be vigilant about masking and distancing. So after 4 weeks, we went from 70% of our cases being attributable to Grand Valley to 4%. So what that means is these measures work if they're consistently applied and if people take them seriously and if they're willing to, kind of go through some of the inconvenience of wearing a mask and, maybe, when you visit your friends, kind of sitting 6 feet apart, being outside as much as possible. These things really work.
Thank you.
I don't know if I really answered your question. I think, the answer is we are going to have to live with this for a while until we get a vaccine. But let's learn how to live with it and be smart and take care of each other and keep our economy going and our schools open and everything. I think that's really what's important to all of us.
Yeah, Mr. Chair.
Hold on just a minute, Frank. Look, Doug was talking first.
Okay.
We'll let Doug go first.
I didn't see.
Go ahead, Doug.
Yeah, thank you, Mr. Chair. Lisa, just a quick question going back to the college campus question, maybe GVSU and Hope, and what can families be talking about with their college students, as they're coming back from semester break or Thanksgiving break? I mean, what kind of steps should they be taking, the college students be taking?
I think the college students have to take the same steps as everybody else. We're in constant communication with both Grand Valley and Hope. They are seeing increases in cases, not necessarily to the same degree as we're seeing in the community right now at this point. But they're getting close to, they're coming up on Thanksgiving break where kids are going to start going home. And so we're asking them to really monitor for symptoms, to continue to get testing, really be aware of the risks in your household. If you've got family members that have maybe chronic conditions or are immune compromised in any way, it might be a good idea to isolate. But most certainly when they get home, follow those guidelines, masking, distancing. It feels really good to go home. I remember when I was a college student, you just kind of wanted to go home and have mom and dad take care of you or grandma or whoever. And that can be the case. We just have to do it safely.
So if they're getting tested, for example, I mean, like the day before they leave home or leave a small gap of 4 or 5 days, or saliva or nasal test, or what would be the recommendation there?
The testing, as we've mentioned before, is tricky because it's only going to tell you whether or not you're positive that day. It's really if you've been exposed. So what the students want to do right now as they're gearing up to their time when they go home is to stay out of those gatherings and make sure that they're avoiding any kind of exposure with somebody who's positive. And if they are exposed, then going into quarantine, taking that quarantine seriously, and if they become symptomatic, getting a test. Now both of our college campuses are doing surveillance testing, where they'll do periodic testing just to kind of see if there's COVID in the population, and they are seeing that. So I would say continue to participate in that and work with your college or university to stay safe.
Great, thank you, Lisa.
Mr. Garcia.
Lisa, and I don't know if this question is for you or the doc, but I've heard a couple of conflicting stories from folks who might have had COVID and have recovered, and now but they believe that they're immune. What is the latest information on that? So they walk around without a mask now because they're super mask.
There is some information, and Doc, I'll let Doc step up, but if you can avoid quarantine for a period of, I think, 3 months after you've had a positive case of COVID, meaning a lab confirmed case. Outside of that, you can't avoid quarantine, which means, that we just don't know. We don't know if you have a lifetime immunity or just a short period of immunity. I'm gonna turn it over to Doc so he can answer this from a medical perspective.
I just wanted to see Doc because I haven't seen him in a while, so.
Everybody. No, Lisa's absolutely right. The thinking is that once you've come out of isolation, when you're released from isolation, there's about a 90-day period there where you're not considered contagious. And if you are exposed to somebody who is contagious or test positive, that you do not have to go into quarantine. But again, good idea just to wear a mask anyway. I think not only just for safety, but also sets a good example. So if somebody says, hey, I've had COVID, I don't need to wear a mask, tell them put the mask on. It's important still.
Okay, thank you.
Hey, just since I have just a minute here, Lisa did a great job there, but there's just a couple of things I wanted to bring up if I could. One is about the death rate. We're looking for some good news here, maybe in Ottawa County. And I don't know if it's good news or not, but the national average death rate is about 2.5%, and that's also the global death rate. Here in Michigan, we're running higher. We're about 3.5 to even 4.5%. But if you look at the Ottawa County death rate, we're only at about 1.15%. So again, even though, one death is too much, it's nice to know that at least the death rate here is below the national average and below the Michigan average. The other thing I just want to mention too, Lisa said that it looks like some of the schools will be going remote. Part of that, as she said, is that the teachers, the schools are having trouble getting teachers right now. So many of the teachers are out. And not just the teachers, but also they're having trouble getting substitute teachers as well. And in addition to that, we're finding that several of the bus drivers are out now. So what you're going to hear today is that Spring Lake is going to be going to remote till after Thanksgiving. And also Grand Haven High School and the middle school are going to be doing that as well. And I wouldn't be surprised if some of the other schools decide to do that too. And then the only other thing I just wanted to throw in there was Lisa mentioned about the good news on the vaccine, and we're really looking forward to that. Dr. Fauci is saying that maybe as early as next month, some of the high risk people may be able to get the vaccine. On a downside of that, though, is that today, one of the, I think it's the two companies in China that have a vaccine that they're hoping to get out. They had to take one of them off the market today, at least temporarily, because there was a death that was felt to be associated with the vaccine. But other than that, the news from Pfizer and the other vaccines are looking very good here. So I'll turn it back over to Lisa.
Thank you. Questions for Lisa? If not, Lisa, thank you very much for the work that you do in your department, and please pass that on from the board. And thank you for your report that you gave us today and for your patience and waiting online.
Oh, sure. Oh, thank you, everybody.
Thanks. Thank you, Lisa. Okay, County Administrator.
Yes, first, congratulations to each of you, Justin, and the rest of our elected officials. Obviously, we had 100% return, so there's a lot of confidence in Ottawa County government. And, we just continue to chug away on all the items in the strategic plan and the projects like the Justice Center and the SEPTED work we're doing to ensure that our facilities can be as safe as they can be. We do plan to propose again at our next board meeting that we renew our local declaration, probably for another 2-month period. And then also, you'll also be hearing from Marcy soon on my annual review that you do about this time each year. And let's see, I also talked to Chair Bergman earlier today about if the spike continues, if things get worse, we do want to survey the boards. You'll probably be getting a Qualtrics survey that we'll work with Lisa to put together just on how best do we manage board meetings in the next 2-3 months should we get a severe spike and worse conditions. I have asked John and IT to once again look into the main conference room and what it would take to make that into a room where we can stream with the same amount of quality that we do from this room. I know that's subject to maybe a little humor today, but overall, I think this room is our best room to stream meetings from. But I do think that, even as we sit in this room with the plexiglass, with the masks, right now, that's our most feasible option. But I do think that we might get to a point in the next couple months where we at least need to distance you 6 feet, even with masks. And so Roger's on that, we're on that, and we'll be looking at that and putting a survey together to see how best we handle that situation should it arise. And that's it for today.
All right, general information, comments, and meetings attended.
Yeah, Mr. Chair.
Yes.
Yeah, I just want to congratulate the Elections Division and the entire network of clerks here in Ottawa County for the work last week. 170,000 folks voted in Ottawa County. I think Justin said over 100,000 of those are absentee. I think Ottawa County residents should be proud of the work that the election department did as well as their local clerk. So.
Okay, thank you. Anyone else?
Mr. Chair, I just want to remind everybody a special day tomorrow. Tomorrow, the nation honors our veterans. It's Veterans Day tomorrow. I want to encourage this group and anybody that's out on Zoom to look for a way to honor our vets tomorrow. Small things, a cup of coffee, a phone call, maybe a breakfast or a lunch, a card, or just a simple, if you know a veteran, you go to a veteran and say, thanks for your service. It means so much. So if you get the opportunity, if you know a veteran tomorrow, if you post something on Facebook that might be positive for a veteran tomorrow. But remember, tomorrow as a nation, we celebrate Veterans Day. But really, as a nation, every day should really be Veterans Day because men and women are serving this country, not only in the States, but all over the world, so we can do the business that we're doing here today. So try to remember Veterans Day tomorrow. Encourage something, say something positive.
Anyone else? I just want to add to what Al was talking about just a few minutes ago. Every one of my municipalities has been on Zoom and continues to be on Zoom or GoToMeeting or one of the others. None of them meet in person. And yet we are all meeting in person, and I'm thankful for what the staff has done to enable us to do that. But I'm just wondering at this time if you heard what Lisa said, and I'm wondering if at our next meeting, if this spike continues, that I would certainly appreciate it if 4 or 5 of us said that we're going to stay home. And if Al were to send a questionnaire out, and if 4 or 5 of us said that we'll volunteer to stay home next time, I think that would go a long way in terms of setting an example for our community as well, that we are concerned about it as much as anyone else. So I'm just going to add that little piece there.
I don't like meeting with Zoom. I don't like it at all.
Well,
My
that's
attention
okay.
span goes off and they're
Oh, I
talking
would
and I'm
keep
not there. So I'm not, you said your opinion, I'm sending mine. I don't like it.
All right. That's fine. All right. With that, I'll take a motion to adjourn.
So move comment.
Oh, public comment. Yes, that's right. Thank you.
Yes, that's why I'm here.
Is there anyone in the public who'd like to comment at this time? Is there anyone on Zoom? All right, then we're adjourned. We won't even vote on it. Mr. Selsky, thank you.
I don't know.
I was just
Oh, let me
thinking,
see if it's,
while
I
you
think
were
it is.
speaking, I was thinking about
Okay.
many years ago. remember
Yes,
when
you
did
do.
that
Let me
thing
check.
for Gerbers?
It's gonna be windy there if you're outside, Greg, so.
Right.
They're legal.
That's
I
nice.
know.
Thanks again.
Yes.
Yeah, no, yeah, it's important. Okay.